I just have a couple of questions for JIGSAW, if that's okay, Chair, as well. And as I say, all politics is local, so this is a kind of local issue. I represent Dublin Midwest, and I grew up in North Clondalkin, and as JIGSAW know, North Clondalkin was the very first location for JIGSAW, and this was born out of a need for an intervention after a high spate of youth suicides within my area. A lot of these children would have been sons and daughters of friends and neighbours of mine. JIGSAW decided to restructure and move out of the area and go from providing a 5-day comprehensive service within our community to a proposed 1 or 2 day satellite service. And I was part of a really strong campaign that was set up to retain the service in North Clondalkin. And I think that campaign is a testament to the work that JIGSAW had done in North Clondalkin, and that the community really rallied around just trying to keep it there because the vital work that it provided within our area. But with the onset of COVID, there's a lot of residents and a lot of people within the community, especially around the greater Clondalkin area, are kind of a little bit left in the dark on where that is at the moment. So if you can give me an update on what this new service will look like, when it will be operational and where it will be located, that'd be appreciated. Thank you.
Thank you. Thank you, Deputy. And thank you for your question, and thank you also for your support over the last long while for JIGSAW, particularly in Clondalkin and surrounding areas. As you will know, and probably the other deputies will be aware, there's been a significant surge in demand for support and need for support across all of the JIGSAW services. In early March, or the 12th of March, we suspended the face-to-face services, but from today we will be able to roll out those face-to-face services again. Particularly, it's important to say that given the significant increase that there's been in demand, there's been a 200% increase in terms of the looking for support through our e-mental health platforms. We've worked really hard over the last number of months to provide both phone, video and then online support. In relation particularly to the support in Dublin South West, what we are doing is providing support in Tala, which will cover all of the South West area. We had planned to open outreach within the Clondalkin area in April, but because of COVID-19, obviously we had to suspend that face-to-face support. Our plan would be to roll that out and to continue to do that. So as we know from next week, we'll be able to provide face-to-face support within the Dublin South West area. What we're able to do at the moment, and what we have been able to do for March, is provide phone, provide video, and provide online support.
Just to come back on that a small bit as well, and one of the problems that we had when it was being moved out of Dublin Midwest to Dublin South West would be the lack of public transport and infrastructure. There's a lot of areas that wouldn't have a direct bus up to Tala in the Clondalkin and Lucan area, which is quite difficult. And it's also quite difficult for young people that are suffering from mental health trauma or whatever they're experiencing at the time to actually get on a bus or get on public transport and make their way up somewhere where they had something that was really local. So in the consideration of the locality for the satellite service, if you can take that into consideration, that would be really appreciated by the people in Clondalkin, that they have an easier access to it than it would be in Tala. Just one more question, and I don't know how I am at time at the moment, but in relation to the face-to-face operation that's due to start on the 20th of July. How do you see that? How do you see that happening? And do you expect an impact on waiting lists and waiting list times as well?
We're following all the HSE and the government guidelines in terms of providing face-to-face support, so following social distancing and so on. So we've conducted an audit of all of our 12 centres across the country and providing the appropriate support within them. We have been offering young people, as I was saying already, phone and video support, and we will continue to offer that combined level of support. For some young people, they do need the direct face-to-face support. They do need to be able to come into the centre and have that as a safe space. So we will be prioritising those young people. And what we will hope to do is that for some young people, they might have their initial assessments within the centre, but then continue the support either through video or through phone. We're hoping to be able to provide, I suppose, a wider breadth of entry points into the service by providing using various different technologies, as I've outlined. We'll have to wait and see, I suppose, in terms of whether there is an increase in terms of referrals, particularly young people looking for face-to-face. What we'll be doing is encouraging them to avail of a number of different options.
Too was through my interaction with the young people in Clondalkin in relation to mental health. There was a stigma, especially when I was growing up around the area, there was a stigma about talking about how you felt, especially for men and young men growing up. There was a really stigma of speaking of how you're feeling. You were worried about what other people thought you and that kind of stuff. And I'd like to just commend JIGSAW, because that was one of the impacts that you had in North Clondalkin, was that allowed young people to have a place where they could talk about how they were feeling. But not only that, did they speak in a safe place with yourselves, they were bringing that back out into the community. So they were actually having that peer support with each other, where young people were helping young people in relation to what was going on. So I just want to thank you on that, and I want to thank the witnesses for coming here today.